It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
And speaking of changing people's lives, we'll begin with our first doctor, cosmetic surgeon Dr. Michael Thornton, who did a mommy makeover on a mother of 3, which included a unique way for a tummy tuck.
I'm a yoga instructor and fitness instructor, and I've had 3 babies. And after having all 3 babies, I started to realize that no matter how hard I worked, no matter how much weight I lost or how much muscle mass I put back on, I wasn't seeing some of the changes that I wanted to see.
When women have children, their muscles and their abdomen separate, and they sometimes don't come back. And so what happens is that's how they get the little pooch in the lower abdomen region, and it stays there for life.
Before I met Dr. Thornton, I didn't know what I was going to need to have done in order to feel like myself again.
She had a very interesting problem with her abdomen, meaning that she didn't have a lot of skin to remove, but she had a huge separation of her muscles.
He convinced me and explained to me the things that I needed to do, and that no matter how much fitness I did, I wasn't going to see the changes that I wanted to just because of, you know, having 3 babies and what it does to your body.
I came up with a plan with her. It's called an umbilical float. You can't force that procedure on everyone, and you have to pick that person exactly. And Taya was the perfect person, so she had a mommy makeover. With her, I did the minimally invasive tummy tuck, where I just make a small incision in the bottom, and I release the belly button, and it allows it to float upward. And then I go all the way up to the almost near the breastbone, and I sew up her muscles all the way from the breastbone all the way down to her pubic bone. And that literally brings her abdomen back into its normal alignment, so it gets real tight. And then I just stitch her belly button exactly back down where it was before, and then I pull out the excess skin. Well, good candidates in particular for mommy makeovers are just women who are between the ages of 35 and 45. That's kind of our average, that have grown kids and now they want their body back. Usually it's some sort of breast revision surgery in combination with abdominal revision surgery. So when you're done, they have improved breast and they have improved abdomen. And that's really what the mommy makeover is.
I am so glad that I went with Dr. Thornton. I'm so glad that I had this procedure done, because I feel like myself again. I now feel like I look how I feel. It was probably the best decision I ever made.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I've done dance a majority of my life, ever since I was about 2.5 when I first enrolled in tumbling. And over the years, with mirrors and makeup and performing, I kind of realized something's wrong. I noticed my nose was not always the best it could look.
Well, rhinoplasty essentially means reshaping the nose. When you look at the nose, it's in the middle of the face, and we don't really want to draw attention to the nose, whether it's positive or negative. The whole point is you want people to look at your eyes, you want them to look at your smile, your mouth, your overall facial appearance, and the nose you don't want to be a distraction. In terms of aesthetics, you really want to make the nose fit your face.
Dr. Ducic is very open, he's extremely funny, he's very relatable, he gets very involved with his patients. He really tries to figure out how and what needs to be done to get the achieved goal.
In terms of when to have a rhinoplasty, appropriate age is when patients are mature enough. You have to look at the facial features and facial growth. Sometimes you can do corrective nasal surgery on patients as young as 13 and 14 if their facial features are fairly well developed. Sometimes they're not ready till they're 17 or 18 or 19, and so you really have to individualize it. It's important to have a nose that is appropriate for your facial dimensions. You don't want a nose that's too small and somebody with wider cheeks. You don't want a nose that's too large or too prominent. And so it really is a matter of balancing it with the rest of your face.
He explained to me that, the balancing my face was off. He not only recommended a full rhinoplasty job for alignment on my nose, but he also recommended a 4mm implant to my chin and my jaw so that it could help balance out my face. Now, to this day, about 4 or 5 years later, it has definitely made an improvement. I'm definitely more confident. And now with my greater confidence, I've actually been able to have some modeling opportunities and gotten to actually show off my new presence and appearance.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how plastic surgeon Dr. John Barnett was able to help Kimberly regain her self-esteem and confidence with a breast augmentation.
Well, I've kind of always wanted to have larger breasts, but I was married and my husband didn't want me to do it and had a bunch of kids, and so I had a life change. In the 90s, one of my good friends had used Dr. Barnett, and she goes, "Kim, you're starting your life over, go see Dr. Barnett."
A breast augmentation is where there are several incisions. The only one that makes any sense is right here where the crease is. You make an incision, you open up a space for the implant to sit in. Very important to put it on top of the muscle. You make a space. You have already decided what size implant that they need. How do you decide what they want, what they need, how big have they been, how big are they now, how tight is their skin? Or you make the operation fit the patient rather than vice versa.
Afterwards, I was here for hours recovering, and I had a friend take me home, and I slept through the night. Waking up, I had very little pain. After about 4 or 5 days, I was pretty comfortable in going and doing. I took a couple days off of work, and then I was back at work.
When Kimberly came in, she needed some changes in her life. She needed her breast done, or wanted them done, and she wanted a new figure. So that's what we did.
It's great. I love it. He did a great job, and I'm very happy with it.
Her breasts are fabulous, if I do say so myself, which I will. They fit her body. She told me a minute ago she looked like she does now when she was 28 years old. And that's what we did for Kimberly. We just gave her a boost in self-esteem. She's happy. It's win-win all the way around.
Dr. Barnett was very personable, very funny and nice, and he takes time to know you, and he lets you know him. And so then you kind of have a relationship before the surgery. So you feel very comfortable and you trust him. And it was a great experience.
Coming up, we'll see how Dr. Charles Tolson gave Brenda her active life back with a double hip replacement.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're gonna have to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it. Dr. Tolson also had a model of the hip, and he said, this is what the procedure's gonna look like. And he talked through the whole thing, and he says, you're gonna be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Tolson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea.
Bunions are an angular deformity of the big toe. It causes a prominence, which then rubs on shoe wear and often becomes painful.
When you develop a bunion, it's actually this part of the bone that becomes prominent, and the metatarsal starts to move inward, and the big toe actually starts to move towards the second toe.
There are various degrees of it, and they're often hereditary in nature. Contrary to popular belief, it's not from bad shoe wear, although certain shoe wear can obviously aggravate the condition.
Conservative treatment for bunions is limited to basically wearing shoes that have a wider toe box and allow for more room and less pressure of the area.
But often it requires surgical intervention. The surgery for it can vary. There are multiple different procedures to do. Typically what we'll do is take some digital x-rays on a patient and evaluate and discuss with the patient what is the best option for them.
Which involves basically shaving down the bump and moving a portion of the bone over and realigning the toe so that it sits straight once again.
There are other conditions that can affect the big toe, such as hallux limitus. That is an arthritic condition of the big toe joint.
This is different from a bunion in that the pain is located more on top of the toe joint as opposed to on the inside of the foot.
Those symptoms are usually with walking and higher-heeled shoes. It's often how it starts. You can notice it squatting.
Every day, every step, it would hurt. And so now, 5 weeks post-op, I don't have the pain that I had just from walking down the mall. I'm really glad I did it.
Following surgery for hallux limitus, the patient will begin to experience a decrease in pain within 7 to 10 days and also an increase in range of motion at that big toe joint.
She actually told me that if I did not have it done, I'd end up with a fusion or a joint replacement. And a fusion means that you will never wear a high heel. It's like your toe is like straight, there's no bending it. That didn't seem like a good option. And who wants a joint replacement? I want my own joint.
Don't forget, for more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
Now up next, we're going to see how Lisa's life was completely changed with help from bariatric surgeon Dr. Scott Stowers from Bariatric Solutions.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often. Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. Just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. Once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, And she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone. And after I feel like I can take on the world, I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
After the break, Dr. Naila Malik shows us her treatments for younger looking skin without surgery.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
The PSA blood test detects prostate cancer. If your PSA level is high, that may indicate prostate cancer. We used to draw a PSA level on all men age 40 or 50 and every year during their complete physical. That may not be a good idea. In fact, it may be a bad idea. For example, a lot of people have a high PSA when it has nothing to do with cancer, or even if they have a little bit of a prostate cancer, it may not spread, it may not cause a problem, and we do something nowadays called watchful waiting, and that means you just tell the patient that they may have a little area of prostate cancer, but just watch it and see if the PSA starts rising and rising and rising. If you draw a PSA level and it's elevated, you're sort of obligated to do things like biopsies and maybe even surgery. That surgery can cause problems. You can have erection problems and loss of urine when you cough or laugh. So drawing a PSA is controversial. It can save your life if you have prostate cancer and you catch it early and it's an aggressive cancer. But it can cause problems too, because if you draw a PSA and it's elevated and didn't really matter and you get all these surgical things done, you can have side effects from all that surgery.
For additional medical minutes from Dr. Honaker, log on to BestDocsNetwork.com and click on the Medical Minute tab on the home page.
For more information about any of our outstanding doctors you see on today's show, head to the website, BestDocsNetwork.com. That's BestDocsNetwork.com. Now to our next best doctor. Dr. Naila Malik helped one lady get her youthful appearance back through a non-invasive procedure.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the result. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of, take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
And what we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
That's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives. And for more information or to check out hundreds of videos, head to our website. It's bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com. So long, everyone. We will see you next week.